Tracy, Maine is the first and so far only state to move to expand Medicaid under the Affordable Care Act through a voter referendum. But just because the expansion passed on Election Day does not necessarily mean that it will happen. Expanding health care coverage to tens of thousands of low-income childless adults comes with a price tag of tens of millions of dollars. And the fight over that state funding will likely be the biggest non-election Maine politics story of this year.
Some are looking at that story through the lens of the addiction crisis that is killing Mainers at an alarming rate. The legislature's opioid task force's final report is incomplete, according to left-leaning advocates at the Maine Center for Economic Policy. Policy analyst James Mile says the task force report addresses the symptoms of the addiction epidemic, but not its root cause.
What's leading people increasingly to turn to drug use and to substance abuse, and sort of what's keeping them sort of trapped in that cycle.
Miles says access to health care is a big factor in whether someone continues down the road of addiction. That's why he says funding Medicaid expansion in Maine is a no-brainer.
In terms of sort of putting money towards dealing with this problem and in getting people back to work, helping them to participate in the labor force, it's the single biggest and easiest thing that lawmakers could do.
On the other side of the political spectrum is the Maine Heritage Policy Center. Terry Brown is communications director of the right-leaning think tank.
Expanding Medicaid is just not a viable solution to addiction.
Brown and others say there's no proof that expanding coverage will curb addiction.
We did in-depth research, and we have seen 32 states expand Medicaid, and 0 have shown an improved result in drug overdoses or suicides related to opioid addiction.
A spokeswoman from Maine's Department of Health and Human Services told us this today. If Medicaid expansion is not appropriately funded by the legislature, rather than helping those suffering from an opioid use disorder, it will have the opposite effect. We will see successful evidence-based programs and initiatives rolled back to provide taxpayer-funded health care coverage to more than 80,000 people.
Interestingly enough, both sides are pointing to New Hampshire to prove their points. The Maine Center for Economic Policy says expanding Medicaid there provided new coverage to 10,000 people who were struggling with addiction. On the other side of the coin, the LePage administration points out that New Hampshire still has one of the highest overdose death rates in the nation. I'm Paul Merrill, WMTW News 8.